Grateful, all power to you. Peter in Oxford. Peter.
Hello, David. Hi.
Peter, I think you're a GP. Are you a GP?
I'm a GP indeed. I'm semi-retired, but I still see patients. But the reason, first of all, can I say how much I admired what you had to say at the Fabians not so long ago? I was there, and I saw how well you handled a very difficult situation.
Thank you, Peter. That's very kind of you.
I look at that from a doctor's perspective, and I think presence of mind is a very important thing to have in medicine, and you've shown a lot of it. But aside from that, I've been a GP for 40 years. I'm a trainer, and I've been involved in medical education at every level. And I have to say, I hear from my colleagues how things have changed since I was starting out. And the reason why it's important in terms of the A&E rates is that long queues in A&E are a symptom of an under-resourced primary care system. And every pound spent in primary care actually saves several pounds in A&E. Because one of the, well, you know yourself, when patients say they can't see a doctor for a week or two or even longer, then the only solution for them sometimes is to
pitch up at A&E. That's right.
And that's not what A&E is for, but it does tend to lead to increased pressure on resources, which we've been hearing about just now. And we've heard some of the difficult and very sad stories that arise. Now, why is general practice overwhelmed? It's not that GPs are lazy. They're not spending the day on the golf course. They're actually working harder and harder to stand still. There's been a fall in the number of GPs by about 2,000 since the year 2015, which is an 8% or so drop in the total number. At the same time, population has risen by 10%.
Remind us what led to that fall in GPs.
Well,
we weren't training them.
No, it's partly lack of training, but actually, the big factor, David, and you'll know this with your role as Shadow Foreign Secretary, Brexit. Huge numbers of people who would be working in the NHS from other European countries have decided to go home. The NHS has been hugely hit by that, and you know yourself that the number of... And of course, you can't fill those gaps by importing from countries outside Europe. The government tries, and we know there's been massive immigration.
And the truth is, there was no preparation. No. I mean, you don't have to have a view on either side of Brexit. As you know, I expressed a very strong view at the time. Yeah. But there was absolutely no preparation for this. Totally
not. Apart from that, I mean, there's been no real forward planning. I mean, of course, there have been many attempts at this, but the lack of joined-up thinking is very much in evidence. And let me just say two things about that. I mean, first of all, the demoralisation of young doctors, the fact that doctors' incomes have fallen dramatically, and that's hit general practice even more than it's hit people in hospital. Now, we hear all about the hospital doctor strikes. GPs can't strike. But we've just rejected an offer from the government, which essentially means that GPs would get a 2% increase in their practice income, out of which they have to pay their staff and their expenses. Of course, all of those are rising massively, in accordance with inflation. So GPs' incomes have been hugely pinched. Now,
Peter, can I just ask you one thing? Yeah. There's one thing quickly that I do. Out of hours, if you can't see a GP, I'm now going back a few years. Yeah. You used to be able to GPs came to our homes, and that's all gone. Surely, if the out of hours service is also appalling, people will also pitch up in our A&E departments. After 5, 6 o'clock in the evening.
Exactly. Well, I've done. I mean, in my earlier days in practice, I used to visit quite a lot, and of course, each home visit is equivalent to about 4 to 5 surgery consultations in terms of the time you spend.
Yes.
So it's not a solution for everybody, and home visits are if you want to work effectively and use your skills to best advantage, then you see people in the surgery where possible and visit when it's essential. And of course, we know that there are a lot of people who are housebound for whom there's no alternative, and that of course is very good. However, and in terms of out of hours, I've done lots of out of hours work. The service is overwhelmed. I mean, there are waiting times of, many hours for people to even get answered when they dial 111. So that is another symptom of the under-resourcing of the service and the understaffing. Now, the other thing I was going to say about recruitment and retention of GPs is the massive number of people who are leaving the service, retiring early because they're burned out. Many of them say, something of the order of 35-40% of all GPs are now saying that they're within 5 years of retirement. So there's a huge demographic.
So it's going to get worse, basically, Peter. It's about to get significantly worse. Peter, I've got to go to the break. Thank you for calling in and sharing. Very grateful. You're listening to David Lammy on LBC. The time now is 10:47.
LBC. At EDS.